Hello, my name is Madison, and I'm going to be assessing our patient Will today. So first I would walk in, introduce myself, wash my hands, and provide privacy for the patient. I would ask the patient to identify themselves. So what is your name?
Will Ranke.
Do you have any allergies that you know of?
No, ma'am.
I'd verify the wristband. Do you know where you are today?
Yes.
Do you know what time it is?
Yes, I do.
Okay, where are you?
I'm in Keller at my house, and it is about 9 o'clock.
Okay, do you know what day of the week it is?
It is Wednesday.
Okay, very good. So A&O times 4 for our patient. I would say that his general mood and well-being is good. He seems not to be in too much pain. Seems happy for the most part. Are you having any pain today?
Some pain in my left big toe.
Left big toe. So I would use Old Cart to specifically narrow down, where it is, the duration, what makes it worse and better, and what he's been doing to treat his big toe. So on a scale of 0 to 10, what would you say your pain is?
About a 6.
Okay, about a 6. Okay, so then I will start with is it okay if I assess you?
Yes, ma'am.
Normally the patient would be laying down in a robe without clothes, but this is how we're doing it for now. Okay, so first I would check your head and hair. Skin is warm, dry, and intact. No lesions, scars, bruising, no pallor, cyanosis. All color is normal. I'm gonna use my pen light to look in your ears. Do you wear hearing aids?
No, ma'am.
Okay. Any drainage or pain in your ears?
No, ma'am.
Okay, no swelling or redness. Ears appear normal. The next thing we're gonna do is inspect your mouth. If you could open up your mouth. Very good. Any pain?
No, ma'am.
Any swelling? Any redness?
No, ma'am.
Any discharge?
No.
Any trouble swallowing?
No.
Okay. Mucous membranes are moist
Yes.
and pink. Everything looks healthy and normal. Okay, so next we're gonna check the neck and the trachea. Trachea is midline, no pain there.
No, ma'am.
Okay, next we're gonna assess the 9 lymph nodes. So we're gonna do pre-auricular, post-auricular, clavicle. We're gonna do submental, submandibular, post-cervical, pre-cervical, and then tonsillary. And I would do that for all 9 tonsil spots on both sides. I was unable to palpate, so was there any pain on that?
No, ma'am.
Okay. Tonsils are normal, and lymph nodes are normal and healthy. Next, I'm going to auscultate your carotid arteries at different times on each sides to test for any bruit. Okay. Very good. Turn towards this way. Okay. No jugular vein distension in the neck. The next we're going to check your olfactory, which is cranial nerve 1. So I'll have you to just smell this. Okay, very good. And next we're going to assess your vision, which we actually already did at the beginning with the Snellen chart. He has 20/20 with no corrective lenses. Do you wear contacts?
No, ma'am.
Have you ever had LASIK?
No.
Okay, so 20/20 just as the eyes are. Next we're going to assess for PERLA, which is checking to see if the pupils are equal, round, and reactive to light and accommodation. So we're also going to check the 6 cardinal findings of gaze, which is cranial nerve 3. So I'm going to use my pen light. Just look straight at me and follow the pen. Very good. Very good. PERLA is complete. Both pupils equal, round, and reactive to light and accommodation. Next, we are going to check for TMJ, which is cranial nerve 5, and he'll have pain or discomfort when trying to move his jaw. So just try to chew for me. Very good. No pain?
No, ma'am.
Okay, no popping, no crepitus, no issues. Next, we're going to perform the Romberg test. So I'm going to have you stand up. You're going to stand. He's 6'10", so it's hard to get us both in the camera. Okay, so stand with your feet together. And then you'll close your eyes for 10 to 20 seconds, and I'll be here to stabilize the patient in case he's falling about. Perfect. Okay, good balance. And while we're up, we're going to practice the gait as well. So I'll have him walk this way towards the camera. Perfect. Thank you. Very good. And then next, I'm going to perform the whisper test. So I'll stand back behind the patient. Hello, how are you? And the patient will say back what I said.
Hello, how are you?
Okay, perfect. So we passed the whisper test. Next, we're going to check cranial nerve 6. So you'll do a shoulder shrug. Perfect. Then I'm also going to check the tongue movement. Just move your tongue. Perfect. Okay, so he has tongue movement, which is cranial nerve 7. Okay, so next we're going to practice doing hand motions back and forth. I don't know if y'all can see it. So you'll just flip your hands quickly back and forth. Okay, with no difficulty on that. We already did skin assessment. Okay, so perfect. What we're going to move to next is lung sounds. Lung sounds, there are 8 in the front, 8 posteriorly, and then 2 laterally. As of now, the patient is not experiencing any visual adventitious breath sounds, doesn't seem to have any difficulty, no wheezing, everything is symmetrical and bilateral. One, 2, 3, 4, 5, 6, 7, 8. Okay, and then I'll do posterior. 1, 2, 3, 4, 5, 6, 7, 8. And then the 2 bilateral sides. 1, 2. Okay. Breathing rate is normal and equal bilaterally. No rhonchi, stridor, wheezing, crackles, no difficulty. Oxygen stats are normal. Thoracic cage, no pain when you're breathing?
No pain.
Okay, perfect. So next, we are going to do some range of motion exercises for the upper extremities. So if you'll bring your hands forward, out to the side, oh, up, down. Okay, perfect. And then to test for strength, I'll have you pull on my hand. Perfect, and push. Very good, other way. Good job, perfect. Okay, full strength in both sides. Okay, so next we are going to check pulses, the upper extremities. So first I'm gonna check radial pulse. I'll do that for 60 seconds. Make sure that each side of radial pulses are equal. Okay, and then I'll also check the brachial. Make sure those are equal as well. Perfect. And I'll check capillary refill. So I'll squeeze the finger. We want the blood in the finger to come back in less than 3 seconds, so it should turn that same pink color. Capillary refill is great for fingers. Wonderful. Okay, next we're going to listen to the heart. I'm going to start at the apex of the heart, which is the 5th intercostal space, mid-clavicular line. Okay, and I'm going to listen for the tricuspid valve to ensure that S2 is greater than S1. I'll move over to the pulmonic valve, which is on the right side, making sure that S2 is greater than S1. And the mitral valve. Okay, no murmur, normal rate, regular rhythm, good heart rate. Okay, let's see. Next, we're going to assess the abdomen and bowel sounds. So I'm gonna start at the right lower quadrant. I'll listen for 1 minute in each quadrant. Right upper quadrant, left upper quadrant, left lower quadrant. Bowel sounds are normal, not hyper or hypoactive. When's the last time you had a bowel movement?
Today.
Was it normal?
Yes.
Okay. When's the last time you voided or urinated?
Today.
Okay. Normal?
Mm-hmm.
No pain?
No pain.
No difficulty?
No difficulty.
Okay. I'm going to check the skin one more time. We'll move on to the lower extremities. No scarring, moles, abnormal lesions, no bruising. Skin is normal color. Okay. So next we're going to check your reflex. So we're going to check the patellar reflex. You'll dangle the leg. Just let the knee down. Okay. So I'll hit the knee. Perfect. Other side. Great reflex. Wonderful. And then at this time, I would check lower extremity, skin integrity. Yeah, just one is fine. I will do dorsalis pedal pulses. Okay. Posterior tibialis pulses. Check capillary refill. Perfect. And then I will also check to make sure that we have strength in our feet. Could you push? Perfect. Okay. No trouble walking. Standing. Has good deep tendon reflexes and pulses. They're equal bilaterally. Okay. And so also for the vital signs, he has a blood pressure of 118/21, heart rate of 70, oxygen level is 99 on roop air, respiratory rate is 13, oral temperature 97.1 degrees Fahrenheit. Okay, and I believe I still have about 2 minutes left, so I'm going to check my note card. TMJ. Under the herbs, so for the herbs heart sound, we would use the bell side of the stethoscope. Perfect. Postauricular, preauricular. Perla is cranial nerve 3, 4, and 6. And I think that I did all of the lymph nodes. Okay, thank you. Thank you.